Good morning. I don't know why women are supposed to speak slower, but certainly after I end, you're going to suggest that I speak slower too, because I tend to speak very quickly, and I feel like I have a lot to cover. So what I'm going to talk about today is the setting for the research that we did, the population of at-risk children and their families, a little bit about the database that we built, how we identified multi-system families in Illinois, patterns of their system involvement, and then I was asked to talk a little bit about barriers and potentials around integrating data. So Chapin Hall is an organization that was created in the Civil War to take care of orphans of the Civil War, but 30 years ago the board decided to come to the University of Chicago to produce better statistics and research to inform policymakers to improve the well-being of children. We built a relationship with those policymakers, so we really focus on trying to inform policymakers and practitioners at all levels of local, state, and federal and level, as well as in the neighborhoods, about what they should know about providing better services to children. We're known for our work around the use of administrative data, government social program administrative data, but we also employ a full range of methods to address the issues of children, families, and their neighborhoods. So just to put it relatively crudely, we're trying to identify children at risk of bad things happening to them at scale, really at the population level, for at least those children and families that come to the attention of government. We know there are subgroups of children and families that are with children experiencing adverse childhood experiences, a term we're getting to know better and better. And it's really affected by, this population is really characterized by chronically unemployed parents, very low socioeconomic status, long-term welfare program participants, single-parent families, mothers who had their first child as an adolescent, which was shown by the Kids Having Kids work done a number of years ago. And then there are a number of other issues, families that don't have grandparents living with them, so three-generation families seem to do better, adult alcohol, drug use, and mental illness, which I'll talk about more, a lot of issues around parenting, parental stress, and then just the neighborhood characteristics and what's available to families and the other issues that are happening in neighborhoods. So this is actually a graphic. I got a really full disclosure. I stole this from South Carolina, and they are really pioneers. They started about the same time we did in creating an integrated data system, but they do it through the Budget Control Review Board at the state level, and they put together the data similar to how we put it together, and then they share it not only with researchers but all the agencies and policymakers in South Carolina. But this is our data. We include data on the upper right, light blue, from law enforcement. Beneath that is foster care and child maltreatment investigations. Beneath that is data from Medicaid providers, all Medicaid claims, and data on the Medicaid eligible population. So they may be eligible but not actually getting care. Below that, kind of the welfare programs, which include TANF, child care, SNAP, work programs, and SSI. We also look at employment around wage records, UI benefits, and WIA. Now WIAO, I don't know how to pronounce that. And then we also have data on education in Chicago. We don't have that yet for the entire state, as they're working on the state longitudinal data system, but we have a full set of data on subsidized early care and education, as well as data from Chicago Public Schools. So that's an overview of the data we put together at the individual child, family, adult level across all these programs. Just to compare, people always compare the administrative data to survey data, and this is something I took from Walgren from a few years ago, just comparing the two, just highlighting a couple things in surveys. We can choose which questions to ask across domains, and then there are disadvantages of surveys. And in registered-based data, which was what they call administrative data, we have complete coverage of certain populations, and there's more careful responses to certain limited questions. So our multi-system family analysis looks at, we did this work with the governor's office in Illinois. He's currently in prison, but he did some good work. And the idea was that a small number of families use a large portion of the state highest cost services. And if we could have a deeper understanding of those circumstances, we could do a better job at providing services they need and some prevention for some of those programs. We looked at high cost services, mental health services, substance abuse treatment, adult incarceration, juvenile incarceration, and foster care. I'm talking faster as I look at how much time I have available. These are the data sources that we looked at. So it's from basically from the 90s through 2008. We did this work for a point in time in 2008. This is all individual level data in each of these programs from human services, including food stamps and TANF, all the child welfare data, including child abuse and neglect reports, Medicaid claims data, and incarceration data for both adults and juveniles. In preparing this data, we had to deduplicate each of these data sets first, and then we had to link across the data sets, and then the hardest part was really identifying relationships among individuals so we could create our families. I'll talk a little bit about more how we linked data created these families or extended families. Worked out pretty well because 90% of these families had 10 or fewer members. Was when you look at census data, that kind of coincides really well with what the general population of low-income families looks like. Our multi-system families are families who have experience two of the five services. One person could experience two of them, or two people could experience one of them. We could have any combinations, but they had at least two. And then it costs, we looked at total units, cost per foster care, Medicaid. We looked at all Medicaid costs, not just substance abuse and mental health, and juvenile incarceration data. This is the general findings. We really found the 80-20 rule. 23% of our population had 63% of the problems and used 86% of the dollars that were devoted to these families. We looked at about 500,000 families. We tracked about almost that many problems, and we looked at, they accounted for about $3 billion worth of services. So how we did this was in two different systems. In the welfare data, basically the SNAP data, and in the child welfare data, we were able to connect individuals. So we had individuals in those data. Unduplicating them, we put them together into families in each of the two different systems. So that we connected people who were connected in some way at some point in time in these systems, so we knew who belonged together. And then we put them together across those two systems, and then we connected those individuals to their records. So for Julie and Kyle here, they did not have any of those five programs. Jillian and Henry had one of them, and then this other large group had a number of them. So that was an example of our multi-system family. This is a distribution of the size of our families, which again looks very close to census data. We geocoded all this. We have point level data. We know where these people, exactly where these people live. We have addresses, so we were able to look at the county level across the state, and we looked at how many multi-problem families as part of all households, combining that with census data. So we see in the southern part of the state we have high prevalence of multi-system families. And then in Chicago, we were able, this is at the community level, there are 77 Chicago area communities that we've been working, that sociologists have been working with and others for about 100 years now. And we find that these dark blue areas are traditionally the areas where we have more social problems. And we have up to 40% of our study population in those communities being in multi-system families. You'll see here one of the slides, we go between multi-system and multi-problem. We can kind of argue about that, but it depends what day of the week you ask me, if it's a problem or it's a system issue. The real benefit here is being able to go much lower than this, really go to the census tract level for purposes of targeting services, for purposes of understanding where these children and families are, to understand better how we should deploy resources from the state, from the city, from the county. These dark blue areas, and we really see where the concentration is, these dark blue areas have over 60% of children in those areas living in multi-system families, all children living in multi-system families. We topped it off at 60% because we didn't want to show you the areas that have over 90% of their children living in multi-system families. And when you overlay this with educational failure, it's almost a perfect correlation. The higher the percentage of kids in multi-system families, the higher the educational failure, as you want to expect. So this is really a map, and it hasn't really, we've updated this data kind of informally through now, and we also did this same analysis for 2000, and it doesn't look that different. It's pretty stable over time. This shows how most of the problems we encountered were mental health problems, and relatively few were juvenile incarceration. We're a very low juvenile incarceration state. We found that families with multiple problems were 94% of them were likely to have mental health issues, and you think, well, that's an outpatient thing. They have short-term services. Well, it turns out that 54% of these families that received any mental health services received both inpatient and outpatient services. So that was a huge surprise to us that they, and then for substance abuse treatment, 42% of those who received any type of services were receiving inpatient services also. So it's not, for about half of these families, it's very intensive, costly service. We see here that really for families that have adult incarceration, juvenile incarceration, and substance abuse, they are involved in other services. Families that receive mental health services and are just in the foster care system may only be, there's more likely that they're only in that system and they have receiving that one service. The biggest surprise to us was really child abuse, neglect, or intentional, this could be child abuse, neglect, and intentional injury. Of our multi-system families, 81% of them had reported child abuse, neglect, or a report of an intentional injury from the Medicaid claims data. So you wonder where the violence in Chicago comes from. It's really from a source of these children experiencing tremendous amount of violence in their homes. That's why they're on the streets. We have a lot of additional work to do with here, but at the bottom here, you can also look at the trajectories of these families following cohorts over time to see when these things start in families. We can now begin to look at 3 generations to see how that plays out. So some of the, I have 1.5 minutes here as I talk. So the good news is that a lot of states and cities are developing these sources. They're using these data for many different purposes. Some of them are making some of this data public, available to researchers. But really bringing the data together is not a data source to make public or to put on open data portals. And there are a number of federal initiatives that are making this go forward. The SLDS from Department of Ed. There's workforce data quality initiatives. There's also, for years, the census has been doing the LEHD dynamics programs around employment, but not a lot of work kind of in the child well-being area. So, again, it's happening in different degrees in different places. Best practices are not being disseminated. And one reason is that states often rely on large corporate vendors to do some of this work. And they only go so far. They really don't give states the tools to go to this detail to be able to track individuals across the systems. And then it's also the case that state bureaucracies want to hold on to their data. They're more likely to share their data with us than with each other. And the issue around education that Ann brought up is a big one, that education agencies seldom want to give their data to anybody else, including the governor. It's an issue of silos, which I think you all are aware of. Everything's really connected. Special interests really cause these problems to be separated, but the interaction between a parent having a job, children having good nutrition, and children doing well in school is really kind of an issue of trying to break up the silos. It all starts locally. And part of the issue now is that local government, be it state or city governments, really don't have the resources to put this data together. And the federal and at the same time, the federal government is asking states to be more accountable for what their services are providing. The evidence, the evaluations that are being asked to be done, these tiered evaluations that we all, I think, know about, the pressure on them to provide more data. At the same time, the investment in data at the state level is going down. It's more complicated. We have FERPA, HIPAA, identity theft, more lawyers than researchers. If you get a contract with a state, is how we did this with Governor Blagojevich. It was easier to do. So this is everybody. Everybody needs a favorite graphic. This is mine. And though we've had a lot of luck, the issue, I think, is really in part to better connect academics and government. We have doctoral students, we have faculty, we have really people who would love to get their hands on this data, and we spend a lot of time providing this data to other researchers to do evaluations as well as some more descriptive research. And there's really not enough human capital in government at all levels to do this type of research. But social scientists are skeptical of this data, as you all know. It's not data that they collected. It's not the NLSY. It's not Ad Health. It's not all these other data where they can really have documented. It's hard to work with this data. It's not documented very well. We're doing a big national partnership around documenting data a little bit better. The end is the real barriers to data not flowing to those who need it. The barriers vary from sector to sector, but there are some common themes. These barriers can be addressed by the federal government, I believe. There are many barriers at the federal level, and we need incentives to do this work at all jurisdictions. Thank you.